Hello everyone, today we'll be seeing the topic vesicular-ureteric reflux, and this is the pediatrics book Ghai, and I'll be trying to explain you guys from my notes because it's easy to understand. Now, what is vesico-ureteral reflux? So it is basically an autosomal dominant condition hai, and it is found more common in females. So what happens is vesico, it means bladder, and ureteral is ureter. So there is flow of the urine from the bladder into the ureter, which is abnormal. What is normal? Normal is it flows from ureters to the bladder. Now this is the normal physiology, and then we will see the VUR. Then normal physiology, it includes that this is our bladder and this is the entry of the ureter. So what happens normally is there is mucosa, there is submucosa, and there is muscle is present, and this is just a section of the our bladder. So here we can see that when the ureter is entering into the bladder, then the intravesical portion, that is the ureter which is in the bladder, it becomes narrow, it is oblique. You can see it is narrow, it is oblique, and there is a submucosal tunnel is present, that is submucosal tunnel is present. Now this is the normal physiology, it happens in all of us. So this is the normal physiology. Now what happens in the vesico-ureteral reflux is here the intravesical portion, it is not oblique insertion, oblique it's not occurring. Then the submucosal tunnel, it is short or small as compared to this, and here it is oblique and here it's not. So this is known as the reflux. Which reflux is our vesico-ureteral reflux. Now same thing is written here, that is the retrograde flow, that is the backwards flow from the ureter into the from the bladder into the ureter. And now what does it lead to? It leads to recurrent urinary tract infections, and it is the most common anomaly which is associated with UTI. Now based on this, here the pathology is written, that is there is high grade vesico-ureteral reflux, it leads to renal scarring. Now what after the renal scarring, it leads to decrease in the reduced renal functions, that leads to chronic kidney disease, and that again leads to at last end stage renal disease, and it also leads to hypertension, and this is known as condition that is reflux nephropathy. Now reflux nephropathy is the most common cause of two things. First is the hypertension and the end stage renal diseases, okay, in children. Now there is the grading of the vesico-ureteral reflux. First is the partial reflux. Now what is mean by partial reflux? Here you can see that here the it does not reach the pelvis, okay, it is known as partial. Then grade 2 is complete reflux. It means that it is extending up to the renal pelvis but without dilatation of the pelvis. Now for better understanding, I'll also be showing you the diagram of this. Okay, so this is the grade 1 in which you can see the partial reflux. In grade 2 there is complete reflux. Grade 3 is complete reflux is there, plus there is dilated ureter. Now what is written here, that VUR, it is extending up to the kidney with mild dilatation of the ureter or renal pelvis. So see, you can see here that this mild dilatation is present. Now grade 4 is increased dilatation of the uterus, and here you can see that the dilatation of the uterus has been increased. And grade 5 is distinction of the renal pelvicalical impressions. So here you can see that there are the impressions of the pelvicalical impressions are present. That is nothing but we can remember it as if grade 4 is moderate dilatation of the ureter, and grade 5 is gross dilatation of the ureter, and there is renal pelvis and calyces with loss of the papillary impression on calyces. Okay, same thing is written here, and this diagram will help you understand better. Now comes the treatment. So this is the condition. Now what's its treatment? So basically it is not a very serious condition. It improves with age. By 6 to 10 years it usually improves by itself. But if it doesn't, then the antibiotic prophylaxis should be given, which is a single time and bedtime close you should give at the time after dinner when the child is gonna sleep. Then the drugs which are used, if the child is less than 6 months of age, then cefalozine is used, and if it is the child is more than 6 months of age, then cotrimoxazole or nitrofurantoin is used. Now the duration of the antibiotic prophylaxis, if it is in grade 1 to 3, that is this 3 are there, then till 1 year you have to give the antibiotic prophylaxis, and other grades, that is grade 3, 4, 5 is present, then till 5 years you have to give the antibiotic prophylaxis. And if during this duration, if there is an UTI, urinary tract infection, so instead of the prognosis becomes better if urinary tract infection occurs, that is known as the breakthrough UTI, and for that you have to do the reimplantation of the ureter into the bladder. Okay, so this is it. Also the definition which is written from the book, you should also know that what is VUR. It refers to the retrograde flow of the urine from bladder to the ureter, and also bladder say it can also go to the pelvis at the time of the rest and at the time of the micturition. This 2 times they are present. Okay, now if this is happening, that the urine is going from the bladder to the ureter or pelvis, then the pathogenic organism which might be present in the bladder, it gain access to the renal parenchyma. See, this is the bladder, there may be any organism may be present, so it is getting access to the renal parenchyma, which is very dangerous because it can then initiate inflammation and renal scarring. So this renal scarring word you should remember, and this renal scarring, it leads to reflux nephropathy. So after this you can do the surgical reimplantation of ureter into the bladder also, and for follow up repeat imaging after 18 to 36 months in patient with grade 3 to grade 5 VUR. This is the treatment. Also treatment given in the book, you can draw this chart also. It is Vesico ureteric reflux in grade 1 to 3. There is antibiotic prophylaxis till 1 year, and if breakthrough febrile UTI occurs, then restart the antibiotic prophylaxis in grade 1 and 2. Then in grade 3 to 5, the antibiotic prophylaxis till 5 years you have to give, and then continue beyond 5 years. If bowel bladder dysfunction is present, then there is a breakthrough febrile UTI occurs, and then you have to consider the surgery. With surgery you have to consider, I have already told you, that is reimplantation of ureter into the bladder. That is the surgical correction. So this was a topic about reflux nephropathy, and this short answer question also comes in university, that write a note on the Vesico ureteral reflux. So this was all about this video. Thank you so much for watching, and I also want to show you the view. It's rainy season here, and this is it. Thank you so much. Bye.